Hello everyone, welcome to Pharma Thoughts. Episode 11, Introduction to 21 CFR. Some of our friends have asked me to do a video on this topic, and while I was preparing for this video, I understood that this topic is very broad and exhaustive. There is a lot of information that needs to be covered. So I tried to make this video as simple and as brief as possible. After watching this video, if you feel that some more information is required or if you have some more doubts left, please inform me. I'll be happy to do another video covering your suggestions. So let's start the episode. Agenda for this presentation. In order to understand 21 CFR, we need to understand few other aspects such as what is the difference between an act and a regulation, and what are United States codes, and what are Code of Federal Regulations, which is abbreviated as CFR. And after understanding these topics, we will get into the main part, that is the introduction to the important titles that we use in our industry, that are 21 CFR Part 210, 21 CFR Part 211 and 21 CFR Part 11. Please note that 21 CFR and United States codes, as the name itself implies, are the laws of United States. So obviously the information that we see here is applicable only in United States of America. It is not related to any other country. And also in today's presentation, instead of giving a PowerPoint presentation, wherever required, I'll directly browse through the websites so that you can get a feel of actually where these regulations are available or the codes are available. Hope you will enjoy this. So let's begin with the differences between an act and a regulation. In one of our previous videos, we have seen the differences between a regulation and a guidance. But here, in this case, I am going to tell you the differences between an act and regulations. In order to see that, let's go to FDA website to get some information. So here I am entering into FDA website. It is fda.gov. In this website, I am directly going to the section warning letters. We all know that US FDA inspects the manufacturing companies, and if there are some objectionable observations, they will issue Form 483. If the response to Form 483 is inadequate or the observation's nature is severe, then FDA takes an official action. One of the official action is to issue a warning letter. So here we are in warning letters page, warning letters 2019. I'm going to Office of Manufacturing Quality Letters. This is related to us, and here we can see the warning letters issued by Office of Manufacturing Quality. Unfortunately, the first three warning letters belongs to Indian companies. So let me open one warning letter as a random thing. Please understand that this is an open information. This information is available openly to all. So I'm just randomly picking one warning letter here. It's not to name any company. And here we have seen this warning letter is issued to Strides Pharma Science Limited, and it was issued on July 1st, 2019. I wanted to highlight mainly two things here. First thing is, this warning letter summarizes significant violations of current good manufacturing practice regulations for finished pharmaceuticals, see 21 CFR parts 210 and 211. So it says that this warning letter summarizes significant violations of CGMP regulations. So when they have inspected, they observed some of the violations which are significant violations to CGMP regulations, which are mentioned in 21 CFR parts 210 and 211. So please note down. So 21 CFR 210 and 211 deals with current good manufacturing practice regulations for finished pharmaceuticals. Apart from this, if we see other statement, because your methods, facilities or controls for manufacturing, processing, packing or holding do not conform to CGMP, your drug products are adulterated within the meaning of Section 501A to B of the Federal Food, Drug and Cosmetics Act, FTC Act 21 USC 351A to B. So here we have seen. So they have, when issuing this warning letter, they have referred two things. One is CGMP regulations for finished pharmaceuticals, that is 21 CFR Part 210 and 211. Another one is the FTC Act, Federal Food, Drug and Cosmetics Act 21 USC 351A to B. what is the difference between the regulation and FTC Act? So we will try to see. Before proceeding further, I would like to show you one more warning letter. Here if we see, this warning letter issued to Strides is related to finished pharmaceuticals, whereas there is another warning letter which was issued to Aurobindo Pharma Limited, which is for active pharmaceuticals ingredients. If we see this Aurobindo Pharma letter, which was issued on June 20, 2019, here this warning letter summarizes significant deviations from current good manufacturing practice for active pharmaceutical ingredients. They did not mention any CFR here. There, in the warning letter issued to Strides Pharma, FDA mentioned that this warning letter summarizes significant violations from current good manufacturing practice regulations for finished pharmaceuticals, but which are nothing but 21 CFR 210 and 211. But here for API, they just mentioned that current good manufacturing practice for active pharmaceutical ingredients. So here we can understand one point is that the 21 CFR Part 210 211 regulations are for finished pharmaceuticals, not for API. For APIs, FDA did not issue any 21 CFR Code of Federal Regulations. Instead, they use ICH Q7 as an inspection guide. But again, when it comes to the FTC Act, the statement remains same. Because your methods, facilities or controls for manufacturing, processing, packing or holding do not conform to CGMP, your API are adulterated within the meaning of Section 501A2B of the FTC Act 21 U.S.C. 351 A2B. Whether it is an API or finished formulations, the Act remains same. Within the meaning of the Act, both API and finished pharmaceuticals are adulterated as per FTC Act. Whereas violations were observed with respect to 21 CFR Part 210 and 211 for finished pharmaceuticals, and for APIs it is ICH Q7, though it is not specifically mentioned here. The standard that FDA uses for API inspections is ICH Q7, and here they did not refer to any 21 CFR Code of Federal Regulations. So I just wanted to show you that difference. So we know now that when FDA performs an inspection, it performs as per 21 CFR Part 210 211 for finished dosages, finished pharmaceuticals, and also which in turn complies with the FTC Act. So let us see the difference between the Act and the regulations. So what is the difference between FTC Act and FDA regulations? Here we will find the answers on FDA website itself. As per this page, the Federal Food, Drug and Cosmetics Act is a federal law enacted by Congress, and FDA develops regulations based on these laws set forth in the FTC Act. It is very simple. We know how a government functions. Any government in the world has multiple portfolios. For example, we have finance ministers, we have home minister, we have health minister. Each one of this portfolio has got each individual roles for them to perform. So but the responsibility of implementation of the law is on total government. Like both, if suppose in India we have to approve one law, then we need to take the permission from both the houses, the Lok Sabha and Rajya Sabha. Once these two houses approve a law, then it is enacted into law. After enacting the law, it is the responsibility of the concerned regulatory authorities. Either it can be, if the law is related to traffic, roads and highways, then it may be the responsibility of Road Transport Authority to implement it. And if the law is related to some municipal administration, then Municipal Corporation Authority is responsible to implement that law. Similarly, here in this case, the FTC Act is enacted by the government, and the responsibility to implement this act is with FDA, Food, Drug and Administration Department. So here the regulatory authority is Food, Drug and Administration. They need to implement the FTC Act. So FDA prepares some regulations. These are nothing but a sort of rules and regulations based on the law, FTC Act. The rules and regulations that FDA develops are in line with the FTC Act. So any law or act is enacted by the government, and concerned regulatory authority such as FDA or RTA develops the required rules and regulations and implements them. Hence, when they issued a warning letter, in case of finished pharmaceuticals, they gave reference to 21 CFR 210, 211, which are the regulations related to CGMP for finished pharmaceuticals, as well as to the FTC Act. When they did not follow the GMP regulations, it results in the drug being adulterated as per the definition of FTC Act. Hope this is clear. So we know now what is United States Code and what is CFR, what is the difference between an act and regulations. But where are these available? So let's find them. Where to find the United States codes or the Act, FTC Act? Here, this is another page of FDA website. Here it says that the laws of the United States are organized by subject into the United States Code. So all the laws of United States are available in United States Code, which are separated by subject wise. And it says that among all those subjects, the Federal Food, Drug and Cosmetics Act and subsequent amending statutes are codified into Title 21, Chapter 9 of the United States Code. So in this United States Code, where shall we find the FTC Act? It is available under Title 21, Chapter 9. So where to find this USC? Let's see. Here this website has provided as a direct link to the USC. So let's click on this. So this is the website uscode.house.gov. Under this we can see all the laws of United States are organized into different titles. Title 1 deals with general provision, Title 2 deals with the Congress, Title 7 deals with agriculture, Title 10 deals with armed forces. So similarly we have 54 titles in which all the United States law is enacted, and our interest is in Title 21. The subject of Title 21 is food and drugs. So under Chapter 9 we have Federal Food, Drug and Cosmetics Act. So let's click on this. So what does this FTC Act contain? FTC Act has 10 subchapters. From 301 section, these definitions contain 321 to 321D. Similarly, different sections, again each are organized, subchapters are organized into different sections. So let's see this warning letter issued to strides again. This says that the drug products are adulterated within the meaning of section 21 USC 351A to B. So what is this 351A to B? What does this sentence says, which says that the products are adulterated? Why the products are adulterated? Let us see this section. So it's 351A to B. So now we are in 21 USC, this is FTC, and 351 section starts from is available in subchapter 5, drugs and devices. So in this subchapter 351 section is in part A. So this says section 351 is this one. It says that this is adulterated drugs and devices. A drug or device shall be deemed to be adulterated when A to B. This is A, this is 2A, and this is 2B. So let us concentrate on this for the time being. If it is a drug and the methods used in or the facilities or controls used for its manufacture, processing, packing or holding do not conform to or are not operated or administered in conformity with current good manufacturing practice, to assure that such drug meets the requirements of this chapter as to safety and has the identity and strength and meets the quality and purity characteristics which it purports or is represented to possess, then the drug is called adulterated. The definition is more in legal language, but simply it says that if any drug or device is not manufactured, processed, packing or holding as per GMP requirements, then it is called adulterated. So what is, where are CGMP available? Again, the CGMP are available in the regulations 21 CFR. So why the warning letter mentioned this particular statement is because of that act. In the act, as per the act, this particular company or the methods, facilities or controls used for manufacturing, processing, packing or holding are not conforming to CGMP. Hence, within this section 21 USC 351A to B, the drug is adulterated. That is what the meaning is. So now we know where to find the USC, United States code. So it is at this website. So now let us see where to find the 21 CFR. We have seen where United States code are available, but where the code of federal regulation, the CFR, is available. Let us see that. This is another page of FDA website which gives us a direct link to Electronic Code of Federal Regulations, ECFR it is called. So I clicked on that, and as we know, this is the page, this is the website ecfr.gov, which provides us with the Electronic Code of Federal Regulations. So this is the website which provides us the law enacted by the government in as United States Code. We know there are 54 titles of USC where all the law of United States are covered, whereas when it comes to the matter of federal regulations, we can see here that there are only 50 titles of federal regulations. So in these 50 titles, title 21 is same. It is food and drugs. Both in USC it is food and drugs, and in Code of Federal Regulations it is food and drugs. So let us go to food and drug section. So title 21 of CFR is divided further into 9 volumes and 3 chapters, and again it is subdivided into approximately 1499 parts. But not all these parts are important or relevant to us. They are all important, but they are not relevant to us. For us, the most relevant parts are, first we will see the title part 11, 21 CFR part 11. This is 21 CFR, this is part 11, which deals with electronic records and electronic signatures. This is one of the most important part for us, and apart from that, we are much interested because we have seen in this warning letter that significant violations of CGMP regulations for finished pharmaceuticals, C21 CFR part 210 and 211. So these are part 210 and 211. 210 deals with current good manufacturing practice in manufacturing, processing, packing or holding of drugs general. 211 deals with current good manufacturing practice for finished pharmaceuticals. Now we understood the difference between regulation and act. We know where United States Code or the Act can be found. We know where we can find the Code of Federal Regulations. Hope this is clear to all. So now we understood the basics. So let us now see what is there in 21 CFR part 210, 211 and part 11. So let us get a brief overview of that. Let us see the overview of 21 CFR part 11. 21 CFR part 11 title is Electronic Records, Electronic Signatures. So we know now the industry is moving towards automation. Most of the testing methods or processing methods are in electronic form now. So electronic controls, what are the electronic controls that are required? If they use electronic process or digital signatures or electronic signatures, then what are the controls required? All those requirements are mentioned in this particular title. So this has become very important of late. Many of the companies are evaluating their systems whether they are meeting with this requirement or not. So this title contains 3 subparts. Subpart A, general provision; subpart B, electronic record; subpart C, electronic signatures. Though this looks a very small chapter, the importance is much high. We will discuss in detail about the requirements in another video. Now let us go to 21 CFR part 210. So here this is 21 CFR part 210. The title is Current Good Manufacturing Practice in Manufacturing, Processing, Packing or Holding of Drugs General. So this 210 is a very small chapter with 3 subpoints which states general requirements such as status of current good manufacturing practice regulations and applicability of CGMP regulations and definitions. This part 210 is only as an introduction. It helps as an introduction. It provides definitions, and it gives us the applicability of the CGMP regulations, and it also provides the status. Whereas the real requirements are mentioned in part 211, which is current good manufacturing practices for finished pharmaceuticals. So this 21 part 211 current good manufacturing practice for finished pharmaceuticals is divided into 11 subparts. Each subpart is alphabetically named. Subpart A, general provisions. Subpart B, organization and personnel. And C gives us the requirements for buildings and facilities. D gives us the requirements for equipment. E gives us the requirement for control of components and drug product containers and closures. F details about production and process controls. G details about packaging and labeling controls. H for holding and distribution. Subpart I details the laboratory controls. Subpart J, records and reports. Subpart K, return and salvage drug products. So in total, part 211 contains approximately 11 subparts as per under these subheadings. Now we have seen the two warning letters at the beginning of this presentation. One is related to finished pharmaceuticals, one is related to APIs. As we have discussed there, I would like to again reiterate that FDA did not issue any CFR, Code of Federal Regulations, for API manufacturing. They have issued the CFR for finished pharmaceuticals, that is the formulation. But the requirements, GMP requirements, does not differ much. They are almost same for both API as well as finished pharmaceuticals. But legally, there are no Code of Federal Regulations for API. But as an API is a drug under the definition mentioned under FTC Act, if their practices are not suitable as per the guidance, ICH Q7 guidance, which is accepted by United States of America as a GMP guide for APIs, if it doesn't meet those requirements, then the drug is again deemed to be adulterated as per the FTC Act section 351 2AB that we have seen previously. Hope this is clear. In other videos, we will review in detail about the requirements of part 210 and part 211. Takeaway. In short, let me summarize. Act is different from regulations. We know that now. Act is a law defined by Congress or government or parliament, whatever we call, whereas regulations are defined by the concerned regulatory authorities such as FDA, RTA, etc. Regulatory authority is responsible for implementing the law or act which was enacted by the government. United States laws are organized subject-wise as United States Code, and totally 54 titles are available, in which Federal Food, Drug and Cosmetics Act (FTC Act) is available under Chapter 9 of Title 21 Food and Drugs. Regulations are organized as Code of Federal Regulations. Total 50 titles are available, in which Title 21 is Food and Drugs. Important regulations that are applicable for us are 21 CFR Part 210, Part 211 and Part 11. All the CFR are very important, but these are applicable for us mostly. 21 CFR Part 210 is a small chapter with 3 sections. It is titled as Current Good Manufacturing Practice in Manufacturing, Processing, Packing or Holding of Drugs General, which tells the status, applicability of GMPs and definitions. Whereas 21 CFR Part 210 is titled as Current Good Manufacturing Practice for Finished Pharmaceuticals. It contains 11 parts numbered from A to K. Hope this is clear. We will discuss about Part 210, Part 211 and Part 11 in other videos in detail. These are the reference links that are used in the preparation of this presentation. You can visit the same for more information on this topic. And thank you for watching the video. If you have any suggestions or you need any clarifications, please write to us at pharmathoughts1@gmail.com. Thank you and have a great day.